So starting from the top, cribriform plate is the top of the ethmoid. And whenever you have a cribriform plate, it's telling you that there's tiny little holes. These tiny little holes are called olfactory foramen. The olfactory nerves pass through the olfactory foramen. That's cranial nerve 1, which is the supply for smell. In the middle, on top of this thing, what do we see here? This is the acoustic galen, right? This forms for the attachment for the dura mater, the membranes and meninges of the brain. This right here is the optic canal. See how it crisscrosses right now? That's the optic canal goes through the orbit of the eye. And that's for cranial nerve number 2, the optic canal, for vision. The superior orbital fissure is here. And the superior orbital fissure has several cranial nerve fibers. 3, 4, and the portion of 5 and cranial nerve 6 all pass through. This one right here is the foramen rotundum. That's for the maxillary branch of cranial nerve 5. Now what does cranial nerve 3, 4, and 6 have to do with this area? 3, 4, and 6 all have to do with movement of the eye. And also, 3 is also for constriction of the pupil. 5 has the ophthalmic branch of cranial nerve 5 going through there, so that's going through. And then foramen rotundum has the maxillary branch of cranial nerve 5. They call it V1 is cranial nerve 1, is the ophthalmic branch. V2 is the maxillary branch. And then V3 is the mandibular branch going through foramen ovale. So cranial nerve 5 goes through all 3. Superior orbital fissure for ophthalmic branch, V1. Foramen rotundum, V2, maxillary branch. Foramen ovale, V3 for the mandibular branch. Then right in the middle, on either side of this big structure here, called the sella turcica. This whole thing is called the sella turcica, it means saddle. On either side is the foramen lacerum. And the foramen lacerum allows the internal carotid artery to come up through. This surface of the sella turcica is called the pituitary or hypophyseal fossa, and that's where the pituitary gland sits. Okay. Coming this way, going laterally into the ear, is the internal auditory meatus on both sides, and that's for cranial nerves 7 and 8. 8 is the vestibular cochlea that has to do with hearing and balance. 7 is the facial nerve, and then it pops back down through the stylomastoid foramen underneath. So it comes down through the stylomastoid foramen, and that's cranial nerve 7 coming out. It goes into, 7 goes into internal auditory meatus, and then it drops out through stylomastoid foramen. It goes into the face, the facial expression, and also a portion of the taste of the tongue. Okay, so here we're looking at this view. You can see this is the carotid canal, and actually in a real skull it's patent. It's actually like a midtown tunnel. You go through the carotid canal like the midtown tunnel, and you pop up into midtown through the foramen lacerum. So that's the carotid artery, the internal carotid artery. Passes into the carotid canal, makes a turn through the carotid canal, and goes up through the foramen lacerum. Internal carotid artery. This again, this gives you the cochlear nerve and the cranial nerve 7 going through the internal auditory meatus. By the way, that's the external auditory meatus, right? And that's the stylomastoid foramen. This is the mastoid, and this is the styloid process. Zygomatic arch. Okay, coming back down, here's that jugular foramen. Jugular foramen has several structures going through it, actually 4. It has cranial nerves 9, 10, and 11, and the jugular vein. Cranial nerve 9, 10, 11, and the jugular vein. Cranial nerve 9 is glossopharyngeal. Cranial nerve 10 is vagus. 11 is spinal accessory. Glossopharyngeal has to do with the tongue and throat, so it has to do with swallowing and gag reflex. 10 is the vagus nerve called the vagabond, which goes to all the viscera, all parasympathetic supply, to all your viscera, your heart, your lungs, all your organs. And spinal accessory drops back down and affects shoulder shrugging and a couple of other activities. This is the hypoglossal canal, and that's for the hypoglossal nerve. Again, that's below the tongue as well. This is the foramen magnum. The spinal cord passes through there, and the vertebral arteries come up through from the vertebrae.
Thank you.